The session was about the intracranial hypotension. That's very important, and why should it be not known? It's a field that really have moved forward in the last decade. We have these patients that in the headache clinic that present with a thunderclap headache and a different type of headache, and it is positional. It is when they are upright, it is come, and when they lie down again, it goes away. So crucial symptom and history that we see in these patients, but over time it can muddy. So this positional characteristic goes away. And that's why many of these patients are neglected and not identified. They are labeled as chronic migraine and chronic new daily persistent headache or something like that. But it's a type of headache, a type of disorder that we can treat. So we have to identify them, and it is a fascinating area where we learn a lot about not only headache but also general physiology, neurophysiology. So what is the key problem here is to identify it and ask, how did it start, the headache? This new headache that you present with. And did it start more or less abruptly, or how did it develop? And was this positional feature in that? And then the suspicion is raised. And then we have to go to the next step and do some imaging. And it is brain imaging with gadolinium, because there we can see that there's very specific signs. We call it a Bern score, where you can see the enhancement of the meninges, and we can see many different things, and also venous congestion, and it can mimic other things, also subdural hematoma. That could be critical, but it is it's a mimicker, but it is so characteristic signs, and it has been described in this Bern score here from Switzerland. So and then we takes the next step to take an imaging of the spine with fat suppression, because then we can see whether there's a leak somewhere in of CSF in the spinal canal, and then we are on the right track. And also go for identifying the leak, because if we can close the leak, we can cure the patients. And so it's really a fascinating area, and it not only headache, they can also present with dementia, like that, cognitive problems, hearing problem, dizziness, unsteadiness, and ataxia. So it's a lot of other things that come in. But the key is, how did it start? And very often it starts very abruptly, and that's the key to go to the next journal. And the sooner the better we identify it, because the prognosis is much better if we've identified them early. But still go for it, I work for it, and try to help these patients, because you can cure them. For not only for the headache, but also for the cognitive problem. It's a different person that come back. But you have to team up with a good neuroradiologist, neurosurgeons, and anesthesiologist, because it's a teamwork. And you have to go to a specialized center where they have specialized in this, because it's a learning process, and we work for biomarkers. We work to how is this disease developing, and how's the prognosis, and how can we identify them earlier? That's the key message.